welcome everybody back, and hopefully a few other folks will be coming in to join us. But before I reintroduce Regina, I wanted to make one other comment that I didn't make earlier this morning, but I think it's very timely to make it now. And you've heard a lot of reference, and hopefully it hit home with most, if not all of you, is this critical importance of the work we're doing being in partnership with patients and families. And one of the things that you hopefully will be seeing, and if you don't see this, then we're not doing what we intended to do, that we're going to be much more intentional and explicit about all the work we do around quality and patient safety, that it needs to be done in partnership with patients and families. And one of the things we tried to do from day one, Helen's a wonderful example of that, is reach out to patient and family advocates in our state and have them be a part of the work we're doing at the state level. So from our quality council through every leadership team we have patient and family representatives who have an active voice. And I could tell you some wonderful stories about when we first started the Mission Lifeline program when one of the lead cardiologists said, well, I think it's great we're working with Jan Vick, but she's actually going to be on the team and going to be doing this, and is that going to be the best thing for us to do? And I think if that cardiologist stood up here today, he'd say it would not have gotten near as far as we are if it hadn't been for the fact that she was an active voice. In fact, he sometimes emails and calls her up and says, what do you think about this as far as the way we should approach this next phase in this initiative? So we're not going to be prescriptive in the sense that you have to do that, but you're going to see us, whether it's with our site visits or the way we approach our projects, this care transition initiative, you're going to see that there's going to be an active emphasis on doing this in partnership with patients and families. And one of the things we're going to emphasize, we were talking about this before I came up to the podium, is sometimes it can't be a matter of pointing fingers. We're not talking about who's the enemy, who's the good and bad guy. The enemy is chronic disease. The enemy is the fact that we have poor health status because we have such disparities in the state. We've got plenty of enemies to fight, and it's not each other. And the only way we're going to achieve this is doing it as partners with each other, patients and families, doctors, nurses, other healthcare professionals, community leaders, from the patient level to the community level, and you're going to hear more of that from Maureen in a few minutes. With that said, I want to ask Regina to come back up. She's been a real inspiration to us during the course of the 2 days. And I'd like for her to tell us a little bit about these wonderful paintings that are up here. Regina?
He's tall. That's all right. I'm short. We make great combo. This has been spectacular. I have really enjoyed being by the back door and listening to you for the last day and a half. It's been incredibly powerful and moving. And through that, I was able to create 3 conference paintings depicting the amazing spirit that I've seen here in this space. I wanted to actually start with our luncheon painting, which is called The Flame of Hope. If you were at the luncheon yesterday, you remember the awards were given. We heard an amazing song that was sung about being the best you could be and being good. Also beautiful, beautiful orchestra playing, and we heard about the people who had won the awards. And they were all in honor of Lewis, Helen's son. Now, he was brilliant. He shone like a flame. You know, when he went to the hospital, it was an elective procedure. He bought a book with him, and that book was Dune. Now, I don't know if you've ever read Dune, but Dune has something that I think all of us working in this field is a quote that I should read you. I must not fear. Fear is the mind killer. Fear is the little death that brings total obliteration. I will face my fear, and I will permit it to pass over me and through me. So when I think of Lewis in only 15 and dying in a hospital, I think of him having read that and the peace of mind that it gave him. So I painted Lewis into this painting. He is within the sacred flame, in some ways a sacrificial fire. He burns for us. And in the painting, I painted him about 2 years older. He's about 17, not 15. Because he should have got to grow up. It was a mistake. And it was a mistake that could have been stopped if people would have listened. And in the painting, he's holding a woman, and she's looking at him in the eye, so concerned and listening. And at her breast, she holds her baby. And she's the lives that is saved because of the work that is done in Lewis' name. And that is the flame of hope. The next painting is called Silos. Now, if you were here in the morning sessions and throughout the afternoon of yesterday, you heard a recurrent concept, which was the danger of silos within medicine. And I will truly tell you, after data access, which I think is really a key issue within medicine, that we must have data, after that, we must find ways to connect silos. It's throughout the entire system of medicine, throughout quality, and even patient communities silo themselves. Diabetes communities do not talk to heart disease communities who do not talk to cancer communities. Guess what? We're all patients. We're all patients in the end. We all have valuable experience to share with each other. So as you look at these silos, people are holding hands. And we have a cowboy who's painting, "Go west, young man." You can pioneer this brand new field of partnership, because even cowboys are pit crews, as Atoll told us yesterday. And then we have a nurse who's holding a baby, because guess what? She's a mom too. She's doing a lot of jobs, and she's trying to balance them all while being part of the care team. And it's challenging, but she's still doing it. And then we have Atoll himself, holding her hand and being part of the chain. And with his pocket, there's an actual checklist. Now, he's known as the checklist man, and that's pretty powerful. But I will tell you there is another checklist. It's called Patients Included. If you involve patients in the design of an event, on the stage at an event, and in the audience at an event, then you can put the check for Patients Included. And that's available online. But think about that. Before it was like, we let a patient come. That's not enough. You've got to involve us from the beginning. Then as you go further down, there's a woman who's got very pregnant, and she has a t-shirt on that says 39, because we're trying desperately to get to at least 39 weeks. And so she's in the painting as well. And then we have a patient, and that patient has a level in her hand, because we're supposed to be meeting the patients at the patient's level. And you'll note that she's determining that. The level is in her hand, not the provider's. The provider is standing next to her and holding her, and she has a fishing pole in her hand, because we are not going to give our patients fish. We are going to give them fishing poles. We are going to teach them how to fish. We're going to be part of the care process in their future care. Then as we go further down, we have Ethel and her dog and her violin. Because isn't that what we're trying to reach, right? What the patient wants and not what we think the patient wants. So that's silos. Finally, on the end is from this morning session, and this one is called Never. And that woman there is only clothed in award ribbons. There is nothing on her but award ribbons. Because one of the things we're working for in medicine is a thing called transparency. We're trying to make things really clear. We can have what are called educational experiences, and sadly, the things that have happened to Helen and the things that have happened to me are called educational experiences. But they are not educational experiences if we do not share them widely and freely. And that is a part of what you must do. So this person has medals behind her, medals in front of her. She's trying to strive toward this goal. They're, to some extent, when you wear that many medals, sort of wearing you down. And addressing the fact of never. I agree with our speaker this morning. One of the most dangerous things within medicine, I think, is the never event concept. If you say never, you refuse to admit failure. And if you refuse to admit failure, you refuse to learn. Our brains have an amazing ability to recall a few things. One of them is pictures, but the other thing is a bad event. You think back in your mind in the life that you've had. You can remember with crystal clarity the most worst things that have ever happened to you. It is wrong to not cherish those experiences and learn from them. So those would be the things I would like to leave you with today. I would like to think of you as the flame of hope. What's been done, what's happened to who, and how that empowers us. Silos must be connected. That's one of the major keys of changing everything. And do not accept a system that refuses to admit failure. Instead, learn from it. Thank you.